Hi guys. So my name is Sagar Dogra, and I currently reside in India. So the purpose of me making this, you can say, detailed video or partially detailed videos to sensitize and to share what I've learned till now regarding the situation I'm currently in. So for now, I can just give you a brief overview that I have been diagnosed with category 3 non-bacterial or non infectious um, prostatitis, which is chronic since it's greater than 3 months, and a partial diagnosis of Pedudanal Nurelagia. I'm sorry, I might be spelling it wrong, but it's inflammation of the nerves, peduneal nerves, which I'll explain what it is. Prior to this, let me give you an overview of my basics of my health. My body mass index on the basis is my weight is 120 kgs. Um, I usually lead a very sedentary lifestyle due to uh, my commitments to job, and I rarely exercise. Eat junk food as usual because that is the easy way, and I mostly drink caffeine and priorly, obviously, carbonated drinks. No such previous history of disease or diagnosis except fatty liver, which is grade 2. So, the condition, how I was diagnosed with this, the story began in October when I am usually my age is 27 years old, and being a 27-year-old, obviously we do masturbate a lot, right? And if you're married, you might be having sex a lot, and I'm unmarried, so usually we masturbate. So ideally I do it twice on a daily basis, sometimes more, very rarely, but twice though I'm able to reach, and sometimes single. So basically what happened is that in October, as usual, I was masturbating, and during that course, after I masturbated, when I went to urinate or void, um, pain occurred, like a very burning and painful urination, which is also called dysuria in clinical terms. Now, the pain was, you can say, like someone, uh, like a stone was passing through the urinary urethra, we can say. So after that, I assumed that it may be an infection due to drinking less water, drinking daily caffeine. So I basically up my intake of water and up my intake of citrus fruits, and thought that it will be going along, it will get cured within the coming days. So, but I continued masturbating, thinking that it might be an infection. Now that's where I might have gone wrong, but just giving you more context. And also, one more condition that I was facing since 3 4 months prior to this was constipation. You can say it was a chronic constipation because um, very you can say it was very difficult for me to have bowel movements on daily basis, and I used to strain a lot, right? Because I'm a very anxious kind of person. I get anxious very fast, and I fall into depression with even small things. So when this pain rise, and subsequently I tried everything, but it didn't go away. right? It kept, you know, after 7 days also it was continuing, and assuming that it might be severe infection because I don't wear underwear mostly due to some irritation that I feel, and I thinking that maybe that might be the reason. I thought to go online, read a little bit, and self-medicate, which I did, and increase my uptake of water. And also, one more thing that I did was I started giving me warm baths and you can say sitz baths, right? But the pain increased more and it became worse after I masturbated. It increased twice the intensity, and I can describe the pain that it starts from the middle of the urethra to the tip of the urethra. And when it reaches the tip, it's an exaggerated pain accompanied by penile spasms. The muscles contract, making it very painful to pass the urine, and a constant tingling sensation post and pre urination. Apart from that, you can say burning sensation in the anus, perineum, scrotum, tingling in the anus, scrotum, and constant erections, uncalled, unintentional erections without any history or without any cause. Um, Pain when sitting down. When you stand, pain reduces, but it becomes worse when you sit down. When I walk, run, do some exercise, it becomes worse. I can say it 10 times more that time. And you can say it becomes worse when I drive, especially when I drive my bike. The pain increases 2 times more, and even when I drive a car, it's worst. I cannot drive a car or something for long periods of time. Assuming that I think now 1 month had passed, so I thought that I should connect with my doctor because this pain was worse, getting worse day by day, and it's not stopping. It was not taking any name. There was no stopping this. So started in October midway, went till November, and in December I showed a urologist here in my region, that is Jammu, and he said that it might be a UTI. So you he gave me some medications. I'll tell you which kind. He gave me pregabalin plus gabapentin, which is nerve calming medicine. He gave me, I think, it was 75 mg of pregabalin and I think 150 mg of gabapentin, right? Apart from that, he gave me Zenflox. He gave me a Urispas, which is a flavoxate medication that was 500 mg, and he gave me magnesium and he gave me an alkalizer, which is a mix of citrus roots and magnesium, which aids in passing urination and all. Assuming that they were experts, and I'm very grateful to them. There's no doubt I respect doctors a lot. I started the course of medication, but the pain worsened after taking that medication. So in 10 days again, I went back to him. I told that the medicines are not doing any good, increasing my pain. They are what they are doing. He told me that it's a 1 month course. You have to do it. I'll change the medication. I told fine, maybe it might be that. However, after I took those medications, I did get better 1 2 days from the change of medications, but again the pain returned. And one more point I would like to add, that first doctor of mine didn't give me any diagnosis. He just said to start this and let's see. So, not seeing any improvement, I thought of changing my doctor again, and I thought of consulting another consultant in Jammu only. And apart from that, I also consulted online, but they didn't do any help much. One more point I would like to ask that I missed out is that the pain during all this duration, that is 3 months, it went and came, but became worse after masturbation. and became worse after heat treatment or taking baths and rest all everything I told you. So when I went to the second doctor, he told me that basically I think the conditions that you have told me, that it becomes worse after eating spicy foods, it will become worse after walking, etc. And all these are all resembling prostatitis, and you might be having a non-inflammatory category 3 prostatitis. How he came to that conclusion? I had done my ultrasound, blood tests, everything was done, and none depicted any kind of infection, inflammation, and all the parts are fine. So he told that there's a test called uroflowmetry test, which checks the flow of the urine. That was also fine. So based on that, he told that there's no other intervention or diagnostic required. So this is what I have found out in you, and this is a chronic disease, and medication is the only means for now. Later on, we will look at other enablers, but for now, you have to do your full course of medication. The medication which he gave was, in fact, gabapentin only. That was 300 mg, increased my uptake. And he gave me cystopan, which is used for interstitial cystitis. Apart from that, he gave me painkillers, Vivarium, which I didn't take. And ibuprofen, he told that it's better than Vivarium. If you wish, you can take it, but I didn't take it. I did take it initially, 1-2 times, but after that, I stopped it. So 2 weeks past that, I did feel a little better, but it again becomes worse when I get an erection or something like that. So then I thought that why shouldn't I do my own research and try to understand why is this happening? My life has become a hell, right? I lost my job because of this. I rarely go out of the house because of this. I keep sleeping because of this. Um, I cannot wear tight clothes, tight underwears because of this. And in one word, I guess I'm a bit fucked up my life totally. But still, I'm optimistic because I've seen worse happening to people, and I'm just grateful that I'm still alive and taking breath at least. The important point to note here is that these symptoms are similar to what I have been diagnosed with and with many other diseases, and the only way a person can rule this from another condition which I've discussed, that is Pedudanal Nurelagia, is if he's an expert in this field, right? He should be an expert in pain management as well as your pain management for the part of treatment, and should be an expert in dealing with such cases, because in India especially this is very rare. I mean, doctors are more into the commercial line, wherein just treat your patients, keep them for long term basis, and move ahead. But uh, going very deep into the books and understanding what the problem is, that I don't think most doctors are able to do here. Not that I'm saying wrong about them, but this is the fact, because I have visited and consulted more than 4 5 doctors, and none were able to give me such diagnosis or even come close to this, that it could be a nerve damage. They were saying it's an organ damage, but none of them put me through this direction that it could be a nerve damage, right? So, moving ahead, I thought of putting my symptoms, researched a lot myself, did a lot of self analysis, and I came to this conclusion that it did match the preduneal nerve category. And one more important fact is that the preduneal nerve is one of the causes leading to prostatitis. If you can research it yourself, you will find out. Most people are not able to do this, um, and end up with years of interventions which they don't need. Right? I've read people having their prostate removed literally because of this pain, and later on they were diagnosed with preduneal nerve entrapment, or you can say preduneal nerve problems, and ended up getting work for that. But such activities cause increase the inflammation more, reducing the scope of being able to be treated. Just do remember that. So upon that, I found my cases similar to this, and like I said, uh, what kind of cases will lead to this? Basically, you will be going and urinating a lot, right? You will have dribbling, urinary incontinence. You will be having tingling sensation in your urethra, tip of the penis, perineum, which is the area between anus and penis, and rectum. And sorry, you will have tingling sensation there. You will have in your scrotum constant throbbing. You will be having constant throbbing sensation in your penis, in your perineum, in your uh, scrotum. You will be having extreme dysuria, that is painful urination, right? You will be having painful bowel movements. You will be having constipatory bowel movements. You will be having constipatory bowel movements. You will be having, you can say, mm, let's assume you cannot go and work out. You cannot do any physical exercise. You will be having pain when you sit down, relieved when you sleep, or relieved when you sit which is mostly relieved only when you sleep and when you stand. You cannot drive a bike. You cannot you'll have pain when you drive a bike. You'll have pain when you drive a car. You'll have you may or may not have pain when you heat your body or that area, or may heat it when you have cold. Apply something cold to the area. um, these are some of the facts that you will be facing, right? You'll be having muscle spasms in your feet or in your pain. Yeah, and one important point, you will be having pain in your lower back as well. Constant pain in your lower back. And now all of these symptoms are um, you know will determine something else, but it's important to understand that only a specialist will be able to classify you in this category. So like I said, what are the diagnostic tools? Let's discuss that. So, diagnostic tools, as of what I have studied on the internet, are the first is an MRN, or high resolution ultrasound pictography of the nerves. Now, see, in my state, there's no MRN, but in other states like New the Capital and other high end cities, you can find that there, and in foreign countries, it's very common. So MRN is an magnetic resonance neurography, which gives you a 3D pictorial view of your nerves, and ultrasound is available everywhere. Certain researchers have studied have shown better output in your ultrasound, which is way cheaper. But certain cases have found MRI better. Um, However, I would suggest that you start with an ultrasound, and in case that's unsatisfactory, then you go to the MRI. Just as per you do as per what your doctor guides you, because I'm not a doctor. Second thing is, you will be checked. Your areas where the pain is facing will be palpated. You might have a digital rectal examination to undermine, to find out what are the factors, or if there are any lesions, softness in that area, because the pudendal nerve, like I said, passes through your anus, from your anus to your penis, scrotum, and is connected to many important functions of the body, like your bowel movements, your muscle sphincters of the urethra, and the um, bowels, right? So it's very important to understand that first. Now, moving ahead, these are the first two diagnostics. Second diagnostics will be, third diagnostic will be your, you can say, nerve block. So what they will do is they will inject a nerve block agent in that vein, which is pudendal vein, and they will find if you're getting relief. If you're getting relief, that is the 100%, that is the gold standard of identifying whether it's the pudendal nerve causing problem or not. And if that's available in your city, great. If it's not, you have to go to the city where you can get this test. These are the main three diagnoses, right? There's no other way to diagnose. Other than that, it's your only your physician's skills which will give you even which can aid in reaching such things, and you yourself also can understand by what you're facing if you don't get improvement in your prostatitis problem. Now, see, nerves are very sensitive, right? And some of you might say that no, how can you get pain when you're urinating through your nerves? So you must understand that nerves are everywhere in the body, right? And if it's hurt or damaged, and for whatever reason, and if something passes under it or above it, so it will pain, right? So remember that the doctor will only come up till to this conclusion if you are devoid of any other diagnosis. For example, if you have MRI showing something else, like you might be having a tumor in the back, or you might be having a lesion somewhere else, benign or cancers, whatever it is. God forbid it is there, but or any other blood test is showing something else, or something which is there but which suggests something else. So he will not come to this diagnosis. That might be the issue you might be facing, causing this problem. So this is a very rare problem. It affects maybe one or two in 100,000 people, right? Whereas prostatitis has higher effect rate. This has very low effect rate, and the solution is very important, right? I'm scheduled to show a doctor today who's going to be who's a neuropathic surgeon, very renowned here in Jammu. Um, I'll be showing him and getting his expert opinion on this topic. And I will be letting you all guys know as well. What is his suggestions, what tests I've been told by him, and what is the way to move ahead. Because I'm done showing a urologist now, I think I should involve a neurosurgeon as well to get more insight on this. And like I said, you yourself should be informed so that you're aware of what's going on and you don't get fooled, or you don't just sit there thinking that it's something and later turns out to be something else. What I've learned from the internet is solutions are many. In fact, too many now. Earlier it was very less, but now there are many. For example, you can have your TENS therapy, pelvis therapy. Then you can have your medicines, oral medicines like gabapentin, pregabalin, muscle relaxants, tricyclic antidepressants. They are all there, which is basically it is it is you can say a combination of therapeutic which will be helping you out. It was not a single medicine, but it's a combination. Better diet plan, better voiding plan, a better defecating plan, your behavioral therapies, stress um, reduction, um, you know, your lifestyle changes in your eating habits. These all play a role together. It's a holistic approach which together will help you solve this problem. In my case, I found little improvement when I keep standing rather than keep on sitting. When I eat good fresh diet, I've cut down on all fatty foods. I eat a lot of fish now. That has helped me a lot. Apart from that, I've stopped drinking carbonated drinks and your caffeines. I've finished all of that, and I don't eat any milk products now. I've ordered oat milk, which I read is crucially beneficial. Um, Now I've reduced gluten to a very considerable amount, and I've cut down on spicy foods, cut down on onions, cut down on tomatoes, and I have seen little improvement. I cannot say so much, but it's, let's say, 10 to 15% improvement. See, doctors at only a certain level can help you, but you must first be able to help yourselves. For me, as of now, it's been now been total 4 months since I've been facing this problem. I have cried several times because of the pain and because of depression. Several times I have felt of even suiciding because pain is unbearable. But at the end of the day, you have to see the bright side. My habits were worst. I never ate green vegetables, never ever ate healthy fruits, never ever exercised, never ever thought on meditating, doing yoga. And also, yeah, one more thing, yoga did help me a lot, or is helping me a lot, the breathing exercises, especially. And remember one thing, before you guys start doing any pelvis exercise, you need to understand that certain pelvis exercise will create more tension in your pelvis region where your nerves are present and will cause you even more inflammation. So please, before you do this exercise, I will suggest you do consult expert physiotherapist so that they know more of your condition and can guide you accordingly. Apart from that, there's Aid Plan, which is there on which is an I think an American company. They are very good in this. They have pre-recorded online videos. Sometimes in their special package, you get it for $150. You can get their subscription, and it's amazing. You can consult with them. I think they'll be helpful a lot. I found them through YouTube, and I think they're great. I'm also going to just subscribe with them. Some shortage of money is holding me back, but I think I will go this coming month with them for the prostatitis part. And since both are linked, see, there's no difference. The only difference is one is assumed a nerve damage and the other is assumed a prostate damage or inflammation. But both are connected to the pelvis. So if you're improving your pelvis, you will be improving both, right? What you guys should do, avoid spicy food, avoid fatty foods, avoid sugary foods, avoid foods having higher quantities of sodium. Do yoga daily. Yoga is the easiest form of exercise. You can do that daily. Avoid running, doing strenuous exercises. Avoid using bike for sure. Vehicle, you can put that. Use your donut cushions. That they help a lot by lifting weight from your perineum area, thus creating less tension in the pelvis. Don't sit down a lot. Try working a little by standing up at least 10 to 15 minutes in every 1 hour. These are small changes which you can do and improve yourself, right? In terms of medication, I cannot suggest you anything. I'm not authorized, and neither my suggestion would be good enough for you. My only goal is to ensure that we are together in this and we are able to solve this together, because I understand and I truly believe that many people are suffering from this problem, and like me, many people have lost their jobs and have lost their family life because of this. I'm not married and still, I can understand what married people might be facing, because I understand their personal sex lives and everything is destroyed because of this. Let apart the mental factor, which is the biggest factor here, right? You don't have a mental proper state of mind with this, and I'm here for you. We can discuss this problem anytime if you wish to, because I think this will be a collective effort rather than a single effort. And if we keep sharing our improvements with each other, I think this will be this will be an amazing factor um, in helping us achieve this together. You can connect with me anytime. My Indian WhatsApp number is +91 9622 I'm repeating again. Indian WhatsApp number +91 9622 In case you want to ping me on Instagram, you can ping me at Dogras DOGRASAGAR .in, right? or you can do Sagar Dogra, SAGARDOGRA.in, and we can connect with each other. This is my YouTube channel. You can connect and share your views on this as well. I'm sorry, it's my first video, and the quality might be bad. I'm filming this through my Note 10 Plus, which is a 5-year-old device, but I still love it. I cannot part my ways with it. So I hope to improve it on a daily basis when I keep posting. And main motive of this is to just share our experiences and connect with each other for those people who are new to this problem and those who are having this for a lot of time. So for now, I'm done with this, and we'll keep you informed and posted. Bye.